Yeah, hi, I'm Gail Hunt from the National Alliance for Caregiving. Uh, a point there at the very end, you said that home health is the best setting for long-term care, the least costly setting for long-term care. And I wasn't sure that there's been research that shows that that's actually true if you compare a person, two people of equivalent long-term care needs. One is cared for in the home with the same level of service as somebody in a long-term care facility. So I'm just interested in
So,
that comment.
so it is exactly what you just stated. That's what I was thinking about. When you compare two people who have the same chronic diseases and same disability level, and you look at, for example, skilled nursing facilities versus home health, it is less costly.
My understanding is when they did the channeling demonstration a number of years ago, that was not the case. That's why I'm asking the question, because you weren't able to actually demonstrate that it costs less. People want it more, just like you said, families and patients want to be served in the home, but I didn't think that it actually cost less.
So there has been some more recent research, and some of it sponsored for the Alliance for Home Care Quality and Innovation, that has shown that it
Okay.
is less costly.
Good morning. Amy Berman from the John A. Hartford Foundation. My question is, toward the end of your presentation, you touched on telehealth as one potential opportunity, perhaps having mixed findings, but opportunity and potential. I wanted to go back to the opening of the session and the slides that Bruce laid out. We have a doubling of the older adult population, and in particular, the fastest growing segment is the 85 plus, the oldest old. So we won't just have a doubling of older adults, they will be skewing to greater cognitive impairment, functional decline, all of the things that home health supports so well. My question is on telehealth policy today. Right now, telehealth is supported in places that are either deemed rural or frontier. How might we rethink the delivery of telehealth, the opportunity and the potential of telehealth technology, looking at the acuity of the individual and their own personal access? So thinking about that person themselves as an island when they have extreme cognitive and functional decline, and whether or not it better supports that individual at home versus the costs, the burden, transportation, all of the other difficulties, including the impact on the family caregiver, their own employment. So just thinking from a societal perspective about telehealth policy, what might be your recommendations in that area?
So there are two ways that this can be addressed. I mean, we understand the challenge of older people not being able to use the technology, and that may not be the approach that you want to use. So one way to do this is to maybe use it with younger populations where you shift your resources around, so you can maybe make more daily visits with nurses to those people who are older and use less visits with those who can be supported by the technology. That's one way to go about this. Another way to think about this is it just doesn't have to be remote monitoring and sophisticated technology. It might be outgoing calls to the family member asking about how well the patient is doing and using that information in the care delivery process. So I'm not talking always high tech when I think about the idea of technology. It could be very simple, and the idea of engagement with the family members can make a big difference in terms of the care delivery.
Thank you.
Other questions or comments? Okay, so now we get to take a break. How about that?
Good.
Yeah. We're going to reconvene at 10:15, and we will start right on time at 10:15 with a panel. So Enjoy your break.
Okay.